I want to see the neck problem. Is that the upper body or is that the lower body? Is that the maybe occipital area? The OA joint is stuck. So what I'm doing here, as you know from our assessment book, what I'm doing here, to check my flexion, I want to do rotation. So that's the rule. If I check the flexion, I will do rotation first, and I start ask to tuck chin right now. And I'm looking for 20 degrees. Let me get the camera up here so people can see what exactly I'm looking for. So watch, I'm bringing her, I'm just helping her. I'm not asking you to do, bring it, and now tuck your chin. You see how hard for her to tuck this way? And now go ahead, turn this way and tuck. And this one is actually better. So this one is moving. I want to go back to this.
It's clicking.
It's clicking, so it's no pain?
No pain, right? Just
Clicking. If clicking, it's already telling me something not there. If pain is present, that's no good. It's a negative effect, negative loop back. If you experience pain, clients come back with the pain. With this feedback pain, you already know it's not functioning. So now I'm gonna check this passively. Passively, that's mean I am gonna help her out. And look, I can help her without the problem. So what we do have here, she don't have, the right side don't have the tucked chin. So she can't able to do on her own, but if I help her, it's working. She might don't have, and it's no pain, she might don't have that motor control problem. Her brain forgot how to do that. It's nothing problem with mobility, but usually it's exercise or bands and you can restore that motion, or do some vision. Vision can fix that too. We actually talk about this a lot in our classes. So next one, I want to check rotation. And rotation is start with the flexion. So remember that golden rule? If we check flexion, we rotate head first. And if we do rotation, we put in flexion. I put in 45 degrees. I just hold it like this and ask you to turn to the left as far as possible. I'm looking for 45 degrees. She's good up there. Go ahead and rotate to the right. And look at this. It's no problem at all. It's no problem at all. So for me, she's basically don't have that in this position. She don't have tucked chin on the right side. And it's not mobility problem. It's a motor control problem because I can help her out. Like I said that before. But when she's standing up, she can't turn her head. She gets some experience. Guess what? She's released that spine and no problem up there. She do all those exercises without, all those tests without a problem. So it's telling me it's not in the neck, it's in that spine, in that standing position. We can also do sitting position if you want testing more, but we're gonna keep working on that neck. All right, and this is what I'm doing with the neck. David, do you have any questions?
So if it was just her neck that was a problem,
yeah,
then you'd feel different when she was lying down.
It's if I can't turn, if I can't turning, if I don't get the specific angle, like I said in this book, it's 45, it's 20, and she's laid down, yes, it's a mobility problem and it's in the neck problem. Mm-hmm. We can also do a Burgundy test. When people standing, you hold in that occipital area, and if they sit, then you can start feel that tension in the back of the occipital area, or the heads slide down, or you feel the spine. That's the other one. Watch our previous video, Burgundy test. This is the good test. She don't have neck problems. She have a spine, the thoracic area, and maybe shoulders is limited. Now, as a class called neck case, we already solved the problem. It's not in the neck, but maybe some muscle spasming. Why not? Let's just work on it. And as usual, when I start doing that, let me get that spine. So like I said, her case is like this. She get that jammed. Her spine is jammed. She's kind of everything is locked up here. Most people round it and it's open. I like to push it down, lock it back, create that nice curve, but her story is a different. She's already in here, okay? And her head is not actually forward. So that's our mission today. And also I'm gonna show you on that spine what I'm exactly doing here. My first one, I think you got so much golden chains up here. Yeah, we're gonna take this away. Every time, take those necklace, chain away, because what's gonna happen if you work, you can scratch the customer, clients, or if this is tiny chain, you can break it, exactly. So, and you don't like it, client don't really like it because maybe it's someone really close to their hearts give it to them. Okay, you need help? You got it? Ooh, you got a lot of gold up here. Oh, I like that gold customer. So bring the gold. Okay, I'll put it right in here. Let's see. All right. Gold, gold, gold. All right, my first one, like I said, if this is person come in and car accident, I will not do a lot. I will I place my dominant hand under that cervical area and my non-dominate come on the top. So my dominate close to the neck, and all I do, I just slide gently decompress. I pull. And I also look how she's laid down, position of her leg. You see, she try to correct it, how she feel. I want her to breathe. I want to look at this chest and look at that chest. This chest is up. The right chest is up. So this one is down. It's already telling me I'm right. Everything down in my head. And after she leave, I will do soap notes. This is important to do. So I just decompress. So I want to see that toes is coming gently. I'm going to do a little bit of rotation. Just feel that muscles. Feel good. Next one, I'm not doing a lot of oil. So no oil at all. I just do one drop, make sure my hands is not dry because it's really dry season in California. And what I'm doing now, I just want to feel that cervical area. And what I'm doing, I find that laminum groove and I push it right in here. Just go all the way down to C7, T1, gently. And if I find some bumps, so I just kind of push it up, see the reaction of my clients, and what I find out right here, I always ask, so do you feel that right in here? Yeah. I feel a little bump on the right side, and it's kind of take me away from that laminum groove. So it have to be nice, smooth. So I'm doing a little bit traction in this area, just make sure. And now I'm get close to that bump, and what I'm doing, I just do rotation and kind of a little bit side bending. I rotate very gently, and I kind of push that in very gently. You see what I'm doing here? You feel that? Good. Yeah, her neck is not a problem. This one is a little bit. I think David is going to be more beneficial to work on him, but we'll do some other test on David. So I'm side bending side to side. I rotate and do this motion, and that's my motion. I'm doing this because sometimes if this is side bending, it's stuck. What I'm doing here, you see, I'm kind of pull it out, and it's sometimes clicking, and it's a good stuff. So first was decompression. Now Little rotation and side bending slightly. Next one, I want to work on that scallions muscles because elevator scapula. I found this attachment on the skull right in here, and I slightly down, and I can rotate it, come back, rotate it, and come back. You feel that?
Mm-hmm.
Feels good. Feel good?
Yeah, a bit sore.
Sore. If she's sore, I'm going super slow. In a training purpose, I'm going really fast. In the treatment, the speed is probably twice down, and this is my speed. I rotate. I want to create that rotation better and better. Tuck chin. Remember, she can't tuck. So the assessment and postural assessment and functional movements, it's really important to understand what's going on with the clients. What's to really got to focus on. You can massage this neck to years and years, and it's never going to be better because she got thoracic area locked in, and we need to work on that. So working on that scallions all the way down, kind of gliding down. You see, she's already red up here because no oil. If you get this oil, you're just gonna slide out and up and down. Next one, I want to work on the scallions muscle. I bring that neck to the right. I find that scallions pops up right away. I want to go all the way to beginning of the muscle region, from region to insertion, and I go all the way up. Grab that SEM and just pull this up. So I grab it, hook, and pull it. Sometimes people feel like, oh my God, it's so sensitive. Sometimes they feel it's go to the eye, sometimes go down the arm. Just be gentle. If they feel that, explain them what's this all about. Tell them about trigger points. Educate them. Feel good. How we doing? I always ask how we doing. Doing okay?
Yeah.
Good. Don't do this silent massages. Sitting and hours and hours you're doing something there. You don't explain to your customer. You don't know what you're doing up there. So explain. I'm gonna do the same other side. Working on those scallions. I'm gonna go fast on the left side because the camera is not there. I'll show you standing position. Very slow. She's sore, she said. Grab that SEM, tilt it to the left side, and work on that sternocleidomastoid. Pull it out. A lot of people, not her, but a lot of people get that head forward posture. This SEM, that's a huge muscle. If you turn, you can grab it, you can find it, and it's really sore and sensitive, so you don't want that. Okay. Next one, I'm gonna do decompression again. And my first exercise, my treatment, is going to be restore that right side. So I'm rotate, and what I'm doing here, I ask her to tuck, and I help her out. My left arm holding that occipital area. My right hand is kind of hold the head, and I help her to tuck. Sometimes you're gonna feel that click. It's good. So you see, I rotate it. I'm not do side bending, and I'm doing this. I rotate first to this first restricted barrier, and do that. And you can also do eye neurotraining. I will show you in a minute. So now, if she can rotate, I will rotate the first barrier, and I ask her to go ahead, lock this head off so she's not gonna move, and ask her to look left and right. Only look with your vision. Look left, look right. Look left, look right. So it's the first barrier. Look left, look right. Now look up, look down, look up, look down, Now look to the left and look to the right. And when she looked to the right, I'm turned more. Look at that. Look how beautiful it is. Like I said, the error can be not just in your physical movements, in your muscles, in your joints. It could be in your visual. It can be vestibular problem. It can be the brain neural connection problem, the motor control problem. So you have to, if you know, you can use that. This is the simple to apply to your practice with those eye movements. Learn this from our assessment book. It's everything up there. It's a 42 pages book, and you will find everything you need up there for beginning. And you can go dig in there and get some learning more and more and more. All right, so next one, I want to work on that muscle, posterior muscle. I want to bring her to this 45 degrees. I want to lock it in and ask her to push it down. Push down so she activate all those back muscles in the neck. Is any pain present?
No.
Oh, good. Let it go.
Maybe a little bit soreness, like more down to the spine.
Soreness is okay. I'm gonna ask her to push more, relax, and pull more. Relax. I'll pull a little bit more. I don't want to go like crazy. That's fine. And sometimes if you, this is another position you can do half kneeling. I come up here. You see, I'm on my half kneeling. I place my both palms right under this occipital area. So you see, I hold it, and she's on my elbow. My elbow is supporting, and I just turn this head left and right. Ask her to do that. If any pain present, and I pull more. So I pull up, left and right. It's really good if you feel that occipital area, the occipital is jammed, the joint, you will feel one side is not capable to turn. Always communicate with your client. You see what I'm doing? She's on my palms, my elbow supported. I can pull up, good decompression too. You can do one if you're a big guy. Now I lower it down and I work on that occipital area. So what I'm doing here, I'm working on that OA joint. So I push it this way and that way. Remember, the nerve is coming down this way, so don't be in the middle. Go a little bit away. And this is what I'm doing. I don't know if you see on this camera. Okay, so put the spine away. Grab with 2 fingers. Usually I do this, sometimes 3 if the head is big. And I'm just doing a little side bending, side to side. How's that feel?
Good.
And a lot of people feel that soreness right there. Oh yeah. So I push it up. We already show this, a lot of this technique. Perfect. And you can go back to this technique again, decompress after you're done. You can do rotation, find that laminum groove, and I want to talk. You see what I'm doing here? And talk and go away. And that laminum groove, if that vertebrae is stuck, they will pop. And you do, of course, both sides. I'm just showing you very gently. Don't push too hard. It's sore. Yes, of course it's sore. So this is what I'm doing. I rotate her head and I push this, and I'm rotating this way. You see what I'm doing? I want everything is move. I don't want them stick together. And the most of the time they stick together because they're like a sister and brothers. If one is leaned to the side, another one, they jam together, and people try to do adjustment. They go back to adjustment every other, like 3 times a week. Why? Because that's how they're sitting. You don't do anything to the muscle, to the brain signal, and that's the postural. So you can adjust it like 3 times. It just helps for a couple hours, for maybe 1 day max. All right. Again, decompression and release. Next one, I want to work on that rotation. Remember, she's have difficulties to rotate to the right. What I'm going to do here, I'm actually have to stay on that side. I have to stay on that side, but I will do for the camera on the opposite side. So I have to stay on that side and do this to the other side. I get my palm and scroll all the way down. Yeah, let me show you this way. Perfect. So I'm going all the way to the shoulder, grab that other side, and I start rotating this way and ask her to resist me. And push again, push towards that left side, push this away. There we go. And I scoop up and pull that finger out. Let me show you on that one. So she's on the right side, my left hand, and she rotate to the right. So she activate this muscle, and I'm rotating and pull this out slowly and relax. You see what I'm doing? Get again. I'm going too fast. Usually go slower and relax. Pull more and let it go. Next one, it's a good one. Springing to the side. I like this exercise treatment. I found that clavicle bone. I usually come with my 4 fingers like that. I place it right on that clavicle, and my the big thumb is coming right to the C71. That exactly where that hump is. You know, that little ball up there. And sometimes people get this huge. So I come up here, I found it, I get that clavicle. Now I push this 45 degrees this direction. Oh, and next, and my other hand's pushing towards. So that's the movements. This is what I'm doing here. You see what I'm doing? So head is go to that towards that side, towards the right. I'm do a little bit rotation, slide rotation, maybe like 20 degrees, 30 degrees. Up here, and I start doing that springing. First barrier, she's really good. Take a deep breath. Let it go. You see what I'm doing? I'm pushing down this way. And sometimes when people that stiff neck, you're doing for a minute, like 90 seconds, very nice. Like a bouncing. Don't push too hard, because this is what the chiropractor do. They just adjust it. We don't want that. Use that force. And I do that side bending here. Maybe you're going to see on that one. And you see what I'm doing? So I push this direction. And boom. Perfect. And let it go. Next one, this is that shoulder. I don't like that shoulder. It's really high. Like I said, you can measure that between the shoulder, the clavicular bone, and the table, and you will see the difference. That one is popped more up. So the left one. What I'm doing here, you're probably not going to see it, but when you come live in this class, you would test it with us, you will learn, and trust me, that's the way. I put this arm in 90 degrees, grab that pec muscle, and I gently